So with skiing comes, it's an orthopedic surgeon's dream, right? You get all sorts of injuries while you're skiing. And sometimes the way that people injure themselves, it's hilarious.
How do we take better care of our knee, our meniscus, and our ACL to ensure that when we go gym, we do all exercise, we can still keep it safe?
Very important ligament in the knee.
Sorry, pardon, doctor.
What is in Malay? What is in Malay?
Oh, di lutut ya.
Hey everyone, welcome in today to Disney Channel. You get it? Disney Channel, because today we've got a knee doctor with us, right, doctor?
Yes, that's me.
Doctor, so who is this?
This is Dr. Casey Ang.
Correct.
Yeah, I met him in NUH. So when I started my housemanship, he was a consultant already. By the way, his subspecialty is sports surgery.
But I heard today, actually, he want to talk to us today, in fact, about something about sushi, is it?
Yes. Yeah, I love sushi. Yeah.
You love sushi?
I absolutely love sushi. So I spend a lot of time. I go to Japan a lot. I like going to Japan. But I'm not the only one who likes going to Japan. I think a lot of Singaporeans, Indonesians, Malaysians, they all love going to Japan for sushi. And the latest thing that they go to Japan for is skiing. Skiing is a very, very popular sport amongst men, amongst women, kids, and older people like myself. So
you
skiing,
are not old, Dr. Ang.
Elderly alert.
You are young.
Young at heart.
Young at heart.
But anyways, so Dr. Ni Ang loves sushi. Do you love sushi too, doctor?
Sorry?
Do you also love sushi?
Oh, yes. I love sushi.
You know, about 5 to 6 years ago, right? I actually told a girl that I was seeing. I told her hey, we should go on a sushi date. Do you know why?
Why?
Because you cannot spell sushi without you and I. Now that's why you gotta love sushi. What was your story about sushi? Tell us. We all want to hear.
Oh, well, I don't actually have a sushi story, but I have some ski stories. Yeah. So as I was saying just now, loads and loads of Southeast Asians, Singaporeans, Indonesians, Malaysians, they like going to Japan now. Now they're going for skiing. So with skiing comes, it's an orthopedic surgeon's dream, right? You get all sorts of injuries while you're skiing. And sometimes the way that people injure themselves, it's hilarious. So just early on in the year, I saw a patient. He injured his shoulder. In fact, he had quite a badly injured shoulder. You know how he did it?
What happened?
He was
tell us.
snowboarding, and he was on the phone. So he was
It's a
snowboarding
bad
down the
idea.
mountain. He was on the phone. And maybe the signal wasn't so good, but he crashed into a tree while he was on the phone. So,
Snowboarding
That's a
is
bad
not
idea,
skiing,
man.
right?
snowboarding is slightly different from skiing, yeah. But I have a skiing story too. So I saw a lady the other day, and she was very upset because she injured her knee skiing.
Okay.
And her friend had crashed into her. So I said, "Oh, how did that happen?" She said, "Oh, this friend is very funny. She likes to wear just one contact lens."
Huh?
For some reason. So she wore one contact lens. She couldn't judge distance. And she was aiming. So she aimed the wrong way and she crashed into her friend, my patient.
What? One contact lens?
I have no idea why. But she was skiing with one contact lens.
That sounds like crazy idea. What's the problem?
Can you drive with only one contact lens? But I guess you play stupid games, you win stupid prizes. Welcome to the game of life. Right, doctor?
Correct, absolutely.
Exactly. Yeah, so today, what's up with the knee? Today we're on Disney Channel.
Well, so this lady who injured her knee, she had what we call a ACL tear. Yeah,
ACL.
So an ACL.
Hang on, do you know what is ACL?
I think ACL is advanced Chinese language. Is it true? Is it a secondary school subject?
You have to specify, Dr. Ang.
Okay.
What is ACL?
What is ACL? Yeah.
Okay.
跟我们讲什么是 ACL 呢？
Okay, so ACL, and my Mandarin is terrible. It is called the 韧带. Yeah, so 韧带.
Okay,
It's the anterior cruciate ligament. It's a very important ligament in the knee.
Sorry,
Yeah.
pardon, doctor.
What is
Repeat
in
again?
Malay? What is in Malay?
Oh, di lutut ya.
Lut. Doctor, I think you just gave him a very hard time.
there.
Yeah.
Yeah.
It's okay.
It's in the
ACL.
Yes.
We call it ACL too.
ACL.
Indonesia,
Okay.
we call it ACL.
Okay,
Ligament.
ACL.
ACL.
Right. Okay.
Yeah.
So this is the ACL, anterior cruciate ligament, very important ligament.
So you
4
say
ligaments in the knee.
extra
This
crucial?
is probably the most important.
Anterior
Cruciate.
cruciate ligament.
Yeah, cruciate cross.
Oh, okay. Ligament. Yeah, it's a ligament in the body. ACL.
Yes, ligament.
Yes. Okay. What's up?
What do you call ligament in the knee?
Ligament.
No.
Ligament.
All right.
Cool.
So what's up with the ACL?
Okay, so it's a very important ligament.
Okay.
Right, and it's also a very famous ligament. So many famous
Famous.
sportsmen
Yes.
have torn their ACLs.
Oh yes.
For example,
For example, Michael Owen, many years ago.
Who is-
I think Ronaldo also tore his ACL.
CR7. Okay.
These are famous soccer players. Then, surprisingly, Tiger Woods also tore his ACL.
Tiger Woods,
Tiger
the
Woods,
golf one, the golf
guy.
player. Yeah.
I think he was walking on a course and he fell into a bunker or something accidentally. So that's how he
Okay.
tore his ACL. So golfers are a little bit unusual.
Okay.
And with golfers, because they don't pivot, so ACL is important for pivoting, for moving
Yep.
from side to side. So golfers, you wouldn't think that he would have an issue because golfers just stand there and hit the ball, right? But with Tiger Woods, his swing is so hard and fast. Without an ACL, he struggled. So eventually he had surgery for it.
I see.
okay.
Yeah, so we talk a lot about Tiger Woods, about golf, basketball, and soccer. Actually, doctor, what is the ACL? Where is the ACL? And why is it so important for our body?
Right. Okay. Good question. Good question. Let me just show you on this thing. yeah?
Sure.
So this is a knee, right? Lutut.
Okay.
And this is the top part of the knee. That's the femur,
Okay.
tibia. This is the patella, and this
patella.
is the inside of the knee. Okay, this is the inside of the knee. So there are 4 important ligaments in the knee.
Okay.
2 on the side, what we call
Okay.
the MCL and LCL.
Here, these two sides.
There's 2 sides,
Okay.
correct?
And then?
And there are 2 inside. One is the ACL, which is the one in front, and one is PCL, which is the one at the back. So P stands for posterior, A stands for anterior. So anterior means
I
in front.
see.
And what is the function of the ACL? The ACL is important for the stability of the knee, especially in turning direction. Yeah, what we call pivoting or cutting sports. Things like soccer, basketball, netball, anything that involves twisting and turning, the ACL is important
and
for.
turning.
Yeah.
So it means like when you
Changing direction.
twist your legs.
When you change direction,
Okay.
yeah, when you twist
Okay.
and turn in different ways to get to different places, yeah. So when you have directional change, that's where the ACL comes into play. If
Right.
you're doing straight line sports like jogging on a treadmill,
Okay.
then you don't really need the ACL. Yeah.
walking
But if
also.
you-
You
How about
do.
walking? Yeah, walking.
Not so much lah.
What about-
But of course, if you start running or jogging or walking in a straight line on uneven surfaces, that may still be a problem depending on
Right.
how bad your tear is. Yeah.
Right. I see.
What about if you run, then suddenly you want to stop? If you don't have ACL,
That
what
can be
happen?
an issue also. Yeah.
Oh,
That can also
okay.
be an issue because most of us cannot stop on a dime, right? When you stop, you have to change direction. You have to slant a little bit.
Yeah.
So that can also be a problem. Yeah.
So does like walking, when you walk, right, they say that it helps to strengthen your knees. Is that true?
Somewhat true. So the body responds to stress. Yeah? The more you stress it, the stronger it becomes. So walking is not a very stressful form of exercise.
Okay.
But of course, if you do hill climbing, if you walk at certain speeds, you can give your body a good workout.
Right. I see. Then perhaps, maybe like many people were curious, like they were asking me and asking Dr. Tony as well, how can the ACL be torn? Like what can cause the tear?
That's a very good question. So the way that the ACL is torn is what we call a deceleration injury. So you don't even have to be moving very quickly.
Okay.
What has happened is your foot is stuck. Such as, say, if you're playing soccer, maybe your foot gets planted into a hole. If you're skiing, maybe the ski gets caught in snow. So
Okay.
your foot is stuck. The body keeps moving.
Okay.
And the knee takes the force of your body moving.
Okay.
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 Now, this does not have to be at very high velocity.
Okay.
Repeating more funny stories. I had a patient, he tore his ACL while skiing, but he wasn't actually skiing. What he was doing, he was stationary. He just bent down to help his son tie his straps or boot or ski jacket or something. Right? So he was just bending over a little bit. And then, because the snow was a little bit icy, a little bit slushy, his ski started sliding. So it started sliding, and then it got stuck. And the rest of him followed. That was it. Ligament torn. Yeah. I had another patient. He was trying to get into his house, so he had all his shopping bags, right? He was carrying his shopping bags, and he was backing into his house. So he kind of opened the door. He backed in.
Okay.
Slowly.
Sounds very casual.
Yeah. Boom.
And then he fell down.
He just fell down. Yeah.
And his ACL torn.
Because his foot was stuck.
How old was he? Like, what was his age?
I think this guy was about 40, 42.
Hey, 40 is pretty... 40 and the ACL...
Yeah. And ACL tear can happen at all ages.
Any age?
Any age.
What does someone feel when the ACL is torn? Like, what will they experience?
Another question. So, that's a very good question. Usually, a lot of pain, right? A lot of pain. There's a lot of swelling in the knee, and most patients cannot keep playing their sport. But I have noticed that when people injure their knees in cold weather, in the snow, like skiing, they tend to seem to do a little bit better. They're not so aware of it, maybe because of the cold. And it's not until a little bit later that they realize, oh, I've injured my knee. So it's kind of interesting. That's what I found. Question that a lot of patients ask me is, how can you prevent an ACL?
Yes. What can you do to stay safe?
Now, you can do a few things. For instance, you can get strong before you play. Yeah, so if you're fit, you have strong legs, then usually the chances of an injury is a little bit lessened. You can try not to play or ski at the end of the day, because when you're tired, again, that's when accidents happen. But the truth of the matter is, and I say it again, an ACL injury, or in fact any knee injury, it is an accident, and accidents can happen. You can't prevent it.
Ladies and gentlemen, that's why I guess the main thing here is don't ever skip leg day, right, doctor?
Totally.
Every day is
leg day.
That's right. So take care of your legs, for they will support you for the rest of your life. And now we're going to take a short break. We'll come back again with more knee info as we go knee deep with Dr. Ang, Dr. Sewan Horh.
Anyway.
So, actually was talking to my friend recently, and he actually had an MC. He had an MC for quite a while, in fact. He got my colleague, right? He had an MC for quite a while, and he told me that actually he torn his ACL, and he gave me this word that I didn't understand. He said meniscus.
Right.
And I asked him, sounds like mucus. You tear your mucus? What do you do? Okay, what is meniscus?
So he tore his meniscus. Now, meniscus is quite interesting. I tell you why it's interesting. It's interesting because only the knee has it. So the knee is a joint. What is a joint? A joint is the area between two bones. Why do you need a joint?
Two bones.
Yeah, because you need a joint to move. Right?
Okay.
So we have finger joint, we have knee joint, we have shoulder joint, right? So it's an area between two bones where the bones can move.
Oh, okay.
Now, because the bones move in the joint, you need to have protection. So you have something called cartilage.
Ooh.
Right? Tulang lembut. Yeah. So
cartilage.
Cartilage protects the bone, the ends of the bone.
Okay.
Now, every joint, your finger joint, knee joint, hip joint, shoulder joint, every joint has cartilage.
Cartilage.
But the knee joint has an extra layer of cartilage because it takes so much pressure. The knee joint is like the middleman, right, between your feet, the ground, and the rest of your body. So when your body moves, the knee gets into action, goes into action. So you have cartilage in the knee, And you also have an extra layer of cartilage called the meniscus.
So it forms like a protection, is it?
It's an extra layer of protection.
For the knees?
For knees, yeah.
Only for the
because
knees?
the knees take so much pressure, it needs an extra layer of protection. That's what the meniscus is.
Oh. The meniscus is another layer of cartilage, and it can be torn.
It can be torn, yes.
You know, when you run, right, especially when you go to the gym is really, we do cardio and we do weightlifting. We do like squats, bench press, and some deadlifts. You tend to involve the knee a lot. Right? We do a lot because when you do running, there's a lot of impact on your knee as well, right? How do we take better care of our knee, our meniscus, and our ACL to ensure that when we go gym, we do all exercise, we can still keep it safe? Because now it sounds to me now very risky already. It sounds like it can happen anytime, it can snap at any time. So how do we take better preventive care?
What I do is I tell all my patients that you must be fit and strong to play sport. Yeah, you don't play sport to get fit and strong. So I tell my patients that they need to hit the gym, they need to do strength and conditioning, they need to spend at least half of their exercise time doing strength and conditioning. And then the other half, yes, you can do your cardio, you can do your running, but even that second half, you should also add in a little bit more strength and conditioning. As you can see, I love strength and conditioning. Yeah, so I tell all my patients this.
Wow, that's a great advice. Cardio crazy people, listen to what the doctors say, because doctors say one, and not I say one. Correct or not, doctor?
True.
By the way, Dr. Ang, what sports do you do?
Me, I hit the gym.
You go gym. Do you do other thing?
Yeah.
I do a little bit of wakeboarding.
Okay.
Yeah, I like to do high intensity training, HIIT and all that.
HIIT.
Yeah, but primarily I just like going to the gym.
High five, doctor. I love the gym too. Ooh.
Yeah.
Right, Dr. Sewan Horh. So actually we talk a lot today about the knee, about how you can tear your ACL, how you can tear your meniscus. Still go running, like how you still running in my mind. So you can still go running. But now importantly, we have doctors for a reason, right? So what are the treatment options for somebody who has torn the ACL or the meniscus?
Well, so for ACL tears, we generally advise the patients to have surgery if they are young and if they are active. Yeah. Now, young can mean a lot of things because we talk about we talk about physiological age. Yeah. The oldest patient that I've done an ACL reconstruction on was a 60-year-old lady. Right? Now, why did she need an ACL reconstruction? She's 60 years old. This woman is completely on a different level. She used to be a Olympic gymnast for Canada, right? Canada,
okay.
Not such a famous place for gymnastics, but she was an Olympic gymnast, super fit, and her whole life was centered around just exercising, running, jumping, doing all sorts of things.
Right.
Now, this is quite a long time ago that I did her knee. And I thought, man, this woman is kind of old for me to be an ACL recon. But, today, things have changed. Today, I'm 58. If I tear my ACL tomorrow, I want you to fix it. Tony, you fix my ACL tomorrow, right?
Are you sure you want me to fix it for you?
Of course.
I can do it for you too. Yeah.
Right? So I think we are getting more and more healthy into more and more mature age, right?
Okay.
So when I say young, it's a physiological age. If you are young at heart, physiologically, and you're active, then yes, you should have an ACL reconstruction.
So the treatment is called ACL reconstruction.
Yeah.
What does it entail?
Why do we want patients to have ACL reconstructions? Because number one, without an ACL, the knee is unstable. right? So a lot of patients will say when they do things, when they do pivoting, cutting, as we're saying, sports, they have issues. Sometimes if it's severe, even walking on uneven ground is an issue, right?
Right.
Now, that's one. In younger patients, we're concerned that without an ACL, the knee undergoes a lot of sort of wear and tear, and you become at risk of arthritis in the future, right? All of us are at risk of arthritis. All of us will get arthritis sooner or later. But if you have a torn ACL at a young age and it's not treated, then I personally believe, and again, this is controversial, I personally believe that you are at risk of developing slightly premature osteoarthritis. Now, it's really interesting we're doing this today because yesterday or the day before, there was a very interesting article in the papers, knee surgery on the rise. This is a New Straits Times. Yeah.
Okay.
And one of the patients that they interviewed actually gives a story about how he tore his ligament during his secondary school days.
Okay.
And 20 years later, he's had to have a knee replacement.
Okay, for meniscus tear, how do you decide when to go straight to surgery or when you can treat it conservatively?
Okay.
Great question.
Good question. Yeah. So usually the patient will present with symptoms. Patient will come in. They'll say, "Oh, I've got pain in the knee, pain, clicking, swelling," and generally we'll do an MRI scan and we'll confirm the diagnosis. Yeah. So patient comes in. They have an MRI scan. We've confirmed the diagnosis. Patient has a torn meniscus.
Okay. Right.
On the MRI scan, based on the MRI scan, the patient needs to have surgery, right? But we don't treat the MRI scan. We treat the patient. Yeah. So we talk to the patient, and if the patient's lifestyle is affected by that torn meniscus, then we will suggest that they have surgery. Now, of course, there are certain types of tears where we are a little bit more concerned, right? Where we might say to the patient, "Oh, even if you're not affected that much, maybe you should think about surgery anyway because the type of tear that you have, it's likely to worsen." Right? So those tears, we want to be extra careful, want to be a bit more kiasu. We might be a little bit more aggressive for those tears.
For example?
What we call a root tear. So if you have a root tear, that increases the risk of you getting arthritis.
Do they get the same symptoms as horn tear?
Yeah, they can. Yeah.
Horn tear?
Got a root, got horn, got body. This is the meniscus anatomy.
Another tear is what we call a bucket handle tear. So if you have a bucket handle tear, a lot of patients will get locking and clicking of the knee, but this can go away. So the patient might think, hey, it went away and then it comes back. Then it goes away, then it comes back. And some patients might think, well, since it does go away, maybe I don't need to have anything done. But in fact, what's happening is that bucket handle segment is getting squished. So every time it goes in and out, it just gets worse and worse. So for those patients, we might say, well, maybe you better have surgery. Yeah. But for the vast majority of tears, we would talk to the patient first, ask them if it really affects their lifestyle. And if they say yes, okay, you need surgery. If they say no, they'll say, okay, we just keep an eye on it for the time being.
How long does one have to recover after like a surgery for ACL or meniscus? Like how long does one have to recover before they can resume their sports
ACL
or their stuff?
Longer. I think meniscus, within about 6 to 12 weeks, you should be back on the treadmill.
That's pretty long, okay. ACL, how long is that?
ACL, after 12 weeks, you're back on the treadmill, but you cannot return to sport yet. And it's about 9 to 12 months. 9 months for non-contact sports, 12 months for contact sports. Whereas with meniscal surgery, you can pretty much return to sports about after 12 weeks.
Right.
Is that applicable for professional sportsmen as well after ACL reconstruction? Do they really wait for 6 to 9 months?
If you can afford to spend your entire day doing nothing but rehab, yeah, you can probably go back earlier.
Really? Like how early?
How early is that? Yeah.
It's very hard to quantify that. Yeah. So people have gone back as early as 4 to 6 months. It's I think it really depends on the individual.
Okay.
But you're talking about people whose living depends on
Yes, right.
returning to their sports.
Wow, today we have learned so much about the knee, about ACL, about treatments, about meniscus. I feel like I just had a whole module lecture. Can you please summarize for us what are the key takeaways for our beloved viewers?
Okay, I think the most important thing that I would tell any sort of aspiring sportsman out there is that you must be strong to play sport, not play sport to get strong. That would be my advice.
Alright guys, today we have learned and laughed together so much with Dr. KC Ang, and we hope that you have also learned and to take away something as we continue to run in your mind. So on that note, Doctor, remember to
Subscribe,
like and share. That's right. And together we say, doctors,
Doctors
say one Horh.